we have very high quality testosterone, which means we're able to use a smaller needle for the injection. And that's everybody's biggest fear is pain from the injection. Maybe you can speak to, you are not a big injection person. You started this journey not being excited about doing injections. You were the one that when you were sick and you needed a steroid shot, you were getting clammy and nervous and having heart palpitations just knowing you're about to get a steroid shot.
Well, I am a huge believer in Botox. And my HRT, my testosterone injections, all of my peptides are 10 times easier than getting Botox. So I really, it doesn't bother me. I mean, I think with them being placed in the
You're
rear
right.
end or in the arm, it's a lot easier of an injection. So I don't even really
You are
notice
right
it
about
anymore.
the placement of it
Yeah.
because a lot of times we just think about the size of the needle, but it's also the placement, how it's administered.
Mm-hmm.
And it's something that you don't feel any pain, don't have any bruising or bleeding.
Never.
That is part of high quality medication whenever you're ordering it, that it's high quality so that you can put it through a smaller needle so that you're not having as much of a bruising effect. We also, looking through hormone replacement therapy, being up to date on your cancer screenings and your cardiovascular screenings are a huge part of this because that is part of it in a healthy way. Because testosterone therapy, estrogen therapy, peptide therapy, many of these peptides increase neovascularization. This increases nerve and blood vessel growth. This increases tissue repair, the growth of new muscle tissue, but understanding that they're not blind as far as I'm going to not increase possible cancer and only increase good tissue. They're not that smart. So that means that we have to be very proactive about cancer screenings and being up to date on our cancer screenings.
Well, that's why it's so crucial to receive these therapies and these injections from a physician that you have an intimate, medical relationship with, because they're able to look at you holistically rather than, oh, let's just give you some peptides and, forget about it. This is a strategic care plan of making sure we're looking at the entire body and making sure that we are optimizing, we're safe, we are screening, and we're creating a tailored care plan for our patients. And you're not just getting mailbox peptides or mailbox testosterone from some telemedicine doctor. It's so crucial to partner with your PCP. I mean, OBGYNs are offering it. So, just partnering with your physician, making sure they have a comprehensive look at you as a person, because it's not one size fits all.
No. And I do worry now that we're getting back into an era where it's going to be more available, that we make the mistake because a lot of physicians who traditionally would manage this, because people think endocrinologists do, most of them don't really. Most of them really focus on diabetes. Traditionally, it was primary care physicians, it was family medicine physicians that were managing HRT therapy. And when the black box label came out in the 90s and the hyper corporation of medicine, so where doctors were more employees versus owning their own practices, that went away. Now that it's coming back, I think we have a lot of physicians that were not trained in how to do it and have very little to no experience who are going to try to start again. And that's where we can end up in a very dangerous situation and almost end up right back to where we were at, where if we have an increase in usage, but it's not appropriately done, then we're going to start hearing the horror stories of complications, which really is not so much from the therapy itself. It's really the therapy not being performed in an appropriate way. And cancer screenings are a big part of this. Cardiovascular screenings are a big part of this. We have advanced cardiovascular and cancer screenings that we offer today at our practice that have changed the risk of doing peptide therapies, which increase your own natural growth hormone.
Yeah.
They have made it much, much safer to do because we have a test that with over 90% accuracy tells me we do not have any active growing cancers in our body right now.
That makes me more confident in taking my therapies and taking my injections, because I know that I have done everything I can to ensure that I don't have cancer. or active cancer.
And that does bring us to not just HRT therapy, but even peptide therapies, which really peptide therapies are a form of HRT therapy.
Yeah.
Hormone replacement therapy means many, many different hormones. Many of our peptides that we are using are utilizing increase in natural human growth hormone production. It's also improving insulin like growth factor, another hormone. These are things that naturally decrease with age. They are very common reasons why we have increase in inflammation as we get older, why it takes longer for us to recover from injuries, cognitively, why we start having more cognitive problems. So, peptide therapies are now assisting us with very safely increasing our natural growth hormone production, insulin like growth factor, not only pausing, but somewhat reversing the aging process. And the best way of understanding that is that relationship with your patient and a patient with their physician of what has the testosterone or estrogen helped with and what are we not seeing as much improvement from. And that's where you develop this dual or even sometimes a triple access therapy whenever it comes to hormone replacement. You start utilizing peptides to help with growth hormone production. You first started out with the HRT therapy, which was mainly testosterone replacement without peptides, and then over the last 2 months have added on peptides. Tell me a little bit about what your experience has been since adding the peptide therapy.
I think the lasting energy throughout the day, the entirety of the day, and having more energy from my workout, I think I love my recovery and I love my results. I feel like I get faster results. Feel like my muscle tone happens faster. But my quality of sleep is hands down the biggest thing. I I sleep like a baby now, and it's really, really nice. It makes me feel so balanced because yes, I'm energized in the day and I'm getting great sleep. It just every day I wake up refreshed. It's a really nice feeling.
And it's not using sleep aids.
No.
You're not taking any sleep aids, you're not taking melatonin or Ambien or anything like that.
Yeah.
It really is, this is a perfect example of how we can utilize these peptides to create the optimum environment for your body to function at its best and try to have it functioning whenever you were in your 20s and felt like you could rest and recover without any problems.
Mhm.
Well, your growth hormone levels and your insulin like growth factors are going back to that age. And that's why you're seeing these improvements in the results. It's a lot of times with testosterone therapy, when we do just testosterone therapy, we're wanting to do it in a safe way. That's always the number one priority. So there are times where we are seeing results improve for 2 or 3 days after a shot. And then we start getting to the point where can we increase the dose? You're looking at blood levels and you're looking at different side effects that could be happening. And we don't want to sacrifice skin quality. We don't want to sacrifice hair quality. We don't want to sacrifice mood disorders because if you go on too much testosterone, you can lose hair. You can create very oily skin with a lot of acne problems. You can make your anxiety worse. You can make your sleep worse. So there is a balance. And many times when we have reached the maximum of our therapeutic dosage for our testosterone, to where if we were to go higher, you're going to start seeing more side effects of the therapy that aren't worth it. That's the perfect time to come in with the peptide therapy
Mhm.
because now we are targeting the other axes of hormones that are part of healthy aging, and when they're optimized, they're reversing the aging process. And that's where these peptides come in.
Is this something that I will need to stay on long term? Or is this something that we kind of titrate?
We titrate it, and with the peptides that we use for increasing your growth hormone and insulin like growth factor, we typically do them for 2 to 3 months, and then we take at least 3 months off. We're trying to optimize our muscle mass to body fat and visceral fat percentages here. When we were all younger, our hormones were much more effective and better balanced because we had leaner muscle and our percentages of muscle to body fat were optimized. That's what we are trying to get back to. Our hormones were so great then that we could kind of eat through whatever we wanted to. Well, we have to change our diets now. And a lot of that has to do with your gut microbiome. We did a lot of damage when we were younger in our teenage years and really even, preteen years, adolescent years, eating whatever we wanted, processed foods. Our gut microbiome really got messed up. So we are trying to fix that gut microbiome and optimize the environment to help fix that gut microbiome so that we don't need it on a continuous basis.